Hello friends, welcome to my YouTube channel Healthy Panda Official. Hope you all are good. Today we are going to discuss about the disease thalassemia. Before dive in, please watch this full video and like, share, subscribe my channel. So let's go to the subject. Thalassemia is an inherited blood disorder. It affects your body's ability to produce normal hemoglobin. Hemoglobin is a protein in red blood cells. It allows your red blood cells to transport oxygen throughout your body, nourishing your body's other cells. If you have thalassemia, your body produces fewer healthy hemoglobin proteins, and your bone marrow produces fewer healthy red blood cells. The condition of having fewer red blood cells is called anemia. Thalassemia can cause mild or severe anemia and other complications over time, such as iron overload. Symptoms of anemia include fatigue, trouble breathing, feeling cold, dizziness, pale skin. The gene mutations that cause thalassemia arose in humanity as partial protections against malaria. So, thalassemia affects people who have ancestral links to parts of the world where malaria is prevalent, such as Africa, Southern Europe and West, South and East Asia. Thalassemia is inherited, which means the condition is passed from a biological parent to their child. Hemoglobin consists of 4 protein chains, 2 alpha globin chains and 2 beta globin chains. Each chain, both alpha and beta, contains genetic information, or genes, passed down from your parents. Thalassemia is classified as trait, minor, intermediate and major to describe how severe the condition is. These labels represent a range where having a thalassemia trait means that you may experience mild anemia symptoms or no symptoms at all. You may not need treatment. There are 2 types of thalassemia, alpha thalassemia and beta thalassemia, named after defects in these chains. Alpha thalassemia, you inherit 4 genes, 2 from each parent, that make alpha globin protein chains. When 1 or more genes are defective, you develop alpha thalassemia. 1 defective or missing alpha gene means that you won't experience symptoms. Another name for this condition is alpha thalassemia minima. 2 defective or missing alpha genes means that if you experience symptoms, they'll likely be mild. Another name is alpha thalassemia minor. 3 defective or missing alpha genes means that you'll experience moderate to severe symptoms. Another name for this condition is hemoglobin H disease. For defective or missing alpha genes usually results in death. In those rare instances when a newborn survives, they'll likely need lifelong blood transfusions. Another name for this condition is hydrops fetalis with hemoglobin BARTs. Beta thalassemia, you inherit 2 beta globin genes, 1 from each parent. Your anemia symptoms and how severe your condition is depends on how many genes are defective and which part of the beta globin protein chain contains the defect. 1 defective or missing beta gene means that you'll experience mild symptoms. Another name for this condition is beta thalassemia minor. 2 defective or missing beta genes means that you'll experience moderate to severe symptoms. The moderate version is called thalassemia intermedia. More severe beta thalassemia involving 2 gene mutations is called beta thalassemia major or Cooley's anemia. Your experience will depend on the type of thalassemia you have and how severe it is. Asymptomatic, no symptoms, you likely won't have symptoms if you're missing 1 alpha gene. If you're missing 2 alpha genes or 1 beta gene, you may be asymptomatic. Or, you may have mild anemia symptoms, like fatigue. Beta thalassemia intermedia may cause mild anemia symptoms, or it may cause the following symptoms associated with more moderate disease: growth problems, delayed puberty, bone abnormalities, such as osteoporosis, an enlarged spleen, the organ in your abdomen that plays a part in fighting infection. Missing 3 alpha genes, hemoglobin H disease, often causes anemia symptoms at birth and leads to severe lifelong anemia. Beta thalassemia major, Cooley's anemia, often leads to severe anemia symptoms noticeable by age 2. Symptoms of severe anemia include those associated with mild to moderate disease. Additional symptoms may include poor appetite, pale or yellowish skin, jaundice, urine that's dark or tea-colored, irregular bone structure in your face. Moderate and severe thalassemia are often diagnosed in childhood because symptoms usually appear within the first 2 years of your child's life. Your healthcare provider may order various blood tests to diagnose thalassemia, a complete blood count, CBC, that includes measures of hemoglobin and the quantity and size of red blood cells. People with thalassemia have fewer healthy red blood cells and less hemoglobin than normal. They may also have smaller than normal red blood cells. A respiratory count, a measure of young red blood cells, may indicate that your bone marrow isn't producing enough red blood cells. Studies of iron will indicate whether the cause of your anemia is an iron deficiency or thalassemia. Hemoglobin electrophoresis is used to diagnose beta thalassemia. Genetic testing is used to diagnose alpha thalassemia. Standard treatments for thalassemia major are blood transfusions and iron chelation. A blood transfusion involves receiving injections of red blood cells through a vein to restore normal levels of healthy red blood cells and hemoglobin. You'll receive transfusions every 4 months with moderate or severe thalassemia, and with beta thalassemia major, every 2 to 4 weeks. Iron chelation involves the removal of excess iron from your body. A danger with blood transfusions is that they can cause iron overload. Too much iron may damage organs. If you receive frequent transfusions, you'll receive iron chelation therapy. Folic acid supplements can help your body make healthy blood cells. Bone marrow and stem cell transplant from a compatible related donor is the only treatment to cure thalassemia. Compatibility means the donor has the same types of proteins, called human leukocyte antigens, HLA, on the surface of their cells as the person receiving the transplant. Your healthcare provider will inject bone marrow stem cells from your donor into your bloodstream during the procedure. The transplanted cells will start to make new, healthy blood cells within 1 month. Luspatercept is an injection that's given every 3 weeks and can help your body make more red blood cells. Your body may get too much iron overload, either from frequent blood transfusions or the disease itself. Too much iron can cause damage to your heart, liver, and endocrine system. Your endocrine system includes glands that produce hormones that regulate processes throughout your body.